I didn't know anything about the relationship between salt and blood pressure and hypertension at all. But I remember there was one doctor from our place, American trained doctor, in the 70s. He will come back, he will, at the church, the priest will give him the podium, he will address my people that they should reduce salt intake. That was my first awareness about that. But as a young man, how can I eat food without salt?
We found out that Nigerians consume sodium above the average of what is recommended by the World Health Organization. The World Health Organization recommends 2 grams of sodium for an individual per day. But what we found out on the average that we consume about 3.9 grams of sodium per day.
I've been symptomatic of hypertension for the past a few months will be 40 years. Throughout my undergraduate days, my second year, third year, fourth year, it was all horrible. I was visiting the University Medical Center almost every 2 days. This continued from 75 to 80. I graduated 80. I continued 85, 90. I was also still on the drug. They said I should take it every day. I now ask myself, why me? You understand, as a young person, I was asking myself, why should I be on drug?
Before I go to the findings, maybe I should just give you a brief on the study. So the study is called Nigerian Sodium Study. And what we set out to do is to look at the sodium landscape, both in our food, what we call packaged and unpackaged food, and also in the population. There are 3 aspects of the study. One of them is to engage different stakeholders, both in the health sector, in policy, in the community, in 3 states of the Federation, the FCT, Ogun State, and Kano. The second aspect is doing what we call a retail survey. And the third aspect is to get to the population, whereby we assess through what we call directory recalls and also 24-hour urinary estimation, asking these people some questions, and thereby we estimate the sodium intake in the population. So in short, we are estimating knowledge about sodium in the country. Secondly, sodium in our food, both packaged and unpackaged food, and sodium in the population.
We found out that we're having a very high increase in non-communicable diseases, which includes hypertension, heart failure, stroke, and even cases of stomach cancer associated with high sodium intake. And so, looking at the populace and the health of Nigerians, we decided that we need to urgently address the issue. And in addressing the issue, that was what necessitated the food policy as well as the National Sodium Reduction Guideline.
The sodium reduction guideline is a very critical document developed by the government to ensure the reduction in the cardiovascular disease in the country. And there are so many stakeholders that are involved. So that everybody at a different stage have their different roles to play in the implementation of the guideline.
If you look at the sodium policy that was going to be launched, that is one of the things we're going to be looking into. And that's where the academia comes in also, in sensitizing the population, starting first of all with the healthcare workers, because healthcare workers have a lot of inroad to the population. Then can also with other agencies, the Federal Ministry of Health, the media agencies, for National Agency for Food, Drug and Administration Control, for example, the News Agency of Nigeria. We can also partner with them to sensitize the population. So what are we trying to do, as a second phase of our study, is to use our data, translate them simply to educate the population.
In the document, we have a benchmark set for the level of sodium in different categories of food that they manufacture. Like in the noodles, there's a specific benchmark that is set for sodium level of sodium that should be in the noodles. In bouillons, there's certain category, level of sodium that has been set, the benchmark.
The one message I have for Nigerians is that in as much as we love to have that improved taste in the meals we eat, we should also realize that the more salt we take, the more problems we create for ourselves, and the need for everyone to be salt conscious and reduce the salt we take in our food. And for those who are very particular about processed food, the policy has stated clearly that all manufacturers should state the quantity of salt in each processed food that is in the market. And so based on that, I'm calling on all Nigerians that whatever processed food they want to buy, they should ensure that they read the label accordingly and know the quantity of salt in it before procuring those processed food. And based on that, since they are aware that high salt intake is not good for them, they should consider products that have little or no salt in them.
When you are conscious of the effect of what you are eating, you'll be able to control your taste. So that is the slogan for this sodium reduction campaign. Let your health guide your tastes.